So we are now going to emphasize external rotation of Danny's shoulder, still in passive range of motion. And we have his arm by his side, and so that just allows him to use the elbow as a pivot point so that we produce pure rotation. The tendency is to let the elbow go down, and then we're just working the elbow, but we actually want to move the shoulder. Now there is a precaution with this motion. If the inside of the rotator cuff was involved in the repair, make sure that you have authorization of the surgeon to support external rotation. And so what we'll do is we'll take the base off so you don't have that weight, and then his left arm, non-involved arm, is still producing the motion, and we're using his bolster just as an external support as well. But as you saw on the table, his available rotation was in the neighborhood of probably 35 to 40 degrees before there's resistance. So we're just trying to work within that range, and if we meet resistance, we can hold a stretch there. Okay, so Danny, I'll let you keep going just gently into that limit. And so the same emphasis that we want to have, in this case, rotation of the shoulder is in a different plane. So before we were back and forth, and now we're actually rotating, but we still want to emphasize that pure spin motion in the socket. A progression that we can do as a patient gets more comfortable, and sometimes it is more comfortable to be in this position, so I'm going to bring this bolster up underneath his arm, and that puts his shoulder joint in a little bit more of a neutral position. But it is a progression, so like before, we want to make sure that the body stays relaxed and that we make it a successful treatment session. So this is an isolated plane of movement, but as you saw after the manual approach, is that we can then utilize that gain into a more natural movement. So I would have him, after this exercise, we'd go back to where he was with the combined elevation with external rotation, and just make that more and more comfortable for his nervous system to support, and the preparations for the actual production of movement actively that he'll be doing very soon.